Hello, Junior 1 student. My name is Holly Woods, and I'm a Clinical Experience Coordinator for the BSN program. I'm here to talk to you today about clinical compliance because it's a term you're going to hear a lot throughout the program. Whether you're an on-campus or an online student, it's very important. You will have clinical rotations each term in the upper division courses where you will be physically in a hospital performing clinical skills and interacting with patients, families, and other healthcare professionals. Clinical has several components: learning, practicing, and performing nursing skills, hands-on training and observation in the hospital or other patient care facility, and incorporating critical thinking with technology or simulation. Your clinicals are a great opportunity to see how the hospital and hospital system works. It's also an opportunity for the hospital to see how you work. Think of your clinical as an on-site job interview. Nurse managers watch students carefully, and many students have landed their nurse residency based on their professional interaction with that hospital's patients and staff. The UTA College of Nursing and Health Innovation has established wonderful relationships with our clinical sites. One of the biggest reasons for that is our students' professionalism and adherence to the immunization and certification requirements of each individual clinical location. Our clinical sites are obviously committed to patient safety, but they're also committed to nursing education. They invest in the next generation of nurses by providing dynamic learning environments for UTA nursing students. In return, they ask our students to meet the same agency compliance standards they expect of their own employees. We follow the guidelines of the Dallas-Fort Worth Hospital Council and the documentation standards of our strictest clinical sites. These guidelines apply to all students inside and outside the DFW area. The clinical placement team will send attestation letters to our sites by their deadline, about 30 days before the start of every term. These letters state that each of our students have submitted valid immunization and/or titer documentation in the clinical management system utilized by the College of Nursing. Through this service, we verify that students have completed hepatitis A, hepatitis B, mumps, measles, rubella, varicella, the seasonal flu, and Tdap injections. We also attest that each student has TB testing and BLS provider certification that is valid through the entire upcoming term. Because we have agreed to our sites that students' TB and BLS is valid through the entire program, it is possible that you may be required to complete your annual TB testing and/or your BLS for provider's renewal prior to their expiration. There are no exceptions to this. On the plus side, when you complete your annual TB testing, you only need one TB skin test or blood test. You do not have to do the two-step testing again unless your TB expires before you renew. As for the BLS, ANSA offers renewal courses 3 times a year, and we encourage you to take advantage of that if you need to renew. If you choose to use a different provider, don't forget that your BLS must be an American Heart course. You can search for upcoming courses in your immediate area at heart.org. We will give you a general guideline and deadlines when your immunizations are due, such as your seasonal flu injection. These deadlines are dictated by our clinical sites, so it is imperative that students submit documentation by the set deadline, and preferably well before. Our clinical sites will only allow students who have met all clinical compliance standards to attend rotations in their facility. Therefore, any students who are not compliant will not be included in the attestation letters. We will not penalize students who submitted on time because of one student who did not. Students who are non-compliant are not able to attend clinical, which will affect the student's progression and graduation date. Immunization compliance is a reality in healthcare. Employees at many facilities will be placed on unpaid suspension if they allow their BLS to lapse or miss an immunization deadline set by their employee health department. Remember, we are guests in our clinical facilities. As guests, we honor their site-specific requirements. They have the final say on required immunizations and on documentation standards. If they request additional information or other action from you, you must comply by the deadline they set. Clinical compliance is an important component of your nursing education and one you should take seriously, both for your patient's safety and your own. We truly appreciate your prompt attention to the clinical clearance deadlines. Oh, and be sure to save some copies of your immunization records for yourself. You'll need them when you're hired for your nurse residency after graduation. We truly wish you success in the nursing program. Thank you.